it the consumer option. Democratic Congressman from Maryland, Elijah Cummings, joins me now. Congressman, good to see you. Thanks so much for joining us.
It's good being with you, Nora.
Let me just read from the Miami Herald that says this. Her, meaning Pelosi's new term, consumer option. She said she wanted people to think as their consumer option because the public is being misrepresented as being something that's paid for by taxpayer dollars, which it is not. Do you think rebranding it is actually going to make it more popular? And why, again, call it option? Why not call it choice?
Well, clearly, the fact is no matter what you call it, it's something that's definitely good for consumers. And so I would agree with Speaker Pelosi. She's worked very hard on this issue, and she understands and fully that there are a lot of people who today don't have much of a choice with regard to health insurance. As a matter of fact, many of them have no insurance. So I think that branding it, call it what you will, the fact is that we're going to have a robust public option coming out on our bill out of the House, and it looks like we're going to have a public option quite possibly coming out of the Senate.
Okay, so here's where the rubber meets the road. Okay. Are your buddies in the House going to sign off on a public option like the one that the Senate Majority Leader Harry Reid has proposed, a public option that has this escape hatch, where if you have a Republican governor in the state of Maryland who doesn't like this, he can just opt out of it and leave your constituents without a choice? Will that fly?
Nora, you certainly have raised a key issue, and depending on the politics of a state, some states might opt out and others might not. That is a problem. And I cannot speak for my colleagues, but I can tell you one thing. I think that almost every single member of our Democratic caucus wants to make sure that we do the right thing. And in other words,
Congressman, let me ask you, what about you? Are you willing to say to your constituents, yes, I will go along to get this done for a public option with an escape hatch for a state that may not want to do it? If it means someday in your state, in Maryland, it may mean that they don't get that choice.
I got to tell you, I'm going to have to cross that bridge when I come to it. We're very early in the process, Nora. We're going to have our public option. I think the Senate's going to have theirs. We're going to go to conference. And it's hard to predict exactly what the end will be. But I do believe that there will be a public option, and I do believe that it'll be a bill that I'll be able to vote for. Because, again, I have a lot of constituents who have no insurance and who need that choice. And know that we have to keep the cost of premiums in some kind of some limitations on those premiums. That's very, very important right now, and that's the key.
All right, Congressman Elijah Cummings, great to have you on, and we appreciate it. Thanks so much.
My pleasure.
And you may not believe